Hi, it's Dr. Meyer coming to you from East Bay Disc Centers in Concord, California. I wanted to chat with you briefly about a podcast that I saw earlier. I was cruising around YouTube just checking to make sure that one of our past videos had been uploaded. And I found this podcast where some folks, they weren't chiropractors or doctors of any other type. I'm not sure what their qualifications were. But they were saying that seeing a chiropractor repeatedly who adjust your spine again and again is a pointless waste of money and probably not good for you overall. And in a way I might agree with that. However, I want to explain what good quality care versus really lousy care is, or pointless care, or care provided by somebody who just doesn't have a plan in place and can't get you from point A to point B. So there are many offices out there that will have you come in, you're complaining about a pain somewhere, and on the first day you come in, they maybe do a quick assessment, maybe even not. You lay down on a table, they adjust your spine, thank you very much, we'll see you next time if you're in pain. This is not the way we practice in our office. That, in my estimation, is irresponsible, and you have no idea of what's going on whatsoever. I will tell you that we get patients coming into our office almost every single day who either have had no chiropractic care or have been to other chiropractors like what I just described. And they have never had an x-ray. They have no clue whatsoever about what their spine is actually like, the condition of it. Is it good? Is it degenerating? Etc. So when you come to our office, regardless of whether you are just looking to optimize your health, have better golfing or other sport performance, or because you've been suffering with pain or headaches or sciatica or even a digestive problem or a respiratory problem, the initial consultation is going to include a thorough history taking. We need to get the details on all this stuff. Then we're going to do a thorough examination where I'm going to examine your spine, and we're going to look at other things as well. When we're all done with that, almost invariably, I'm going to order some x-rays. We're going to send you out for the x-rays, and when you come back for your next appointment, we'll sit down and we're going to look at them together. I will explain everything and invite every question you have. We'll also put together the pieces from the intake, the consultation, where we asked you about all aspects of your health, as well as what I found on the examination. At that point, I'm going to give you my recommendations. I practice generally what we term corrective chiropractic care. This is where we want to discover where you're at presently, where you're coming from, and what needs to happen to get you to the best place possible. If that's just getting you out of pain immediately because that's all you want and you don't want to do anything beyond it, that's fine. We'll respect your decision and we'll provide short-term care. But what we specialize in is actually helping people improve their health so that in 5 and 10 and 15 and 20 years down the road, they're not suffering with worse problems because of things happening in their spine or other aspects of their health today that are not appropriately addressed. So if I give a plan of care over a period of months or longer, for instance, you're going to be coming in multiple times. I don't know, it's different for everybody. I can't say in your case it will be multiple times a week, but it might start that way. But the objective is to create the change that we need. We like to measure this change by doing follow-up evaluations, so we're going to check in periodically and re-examine. We may also send out for follow-up x-rays so that we can actually see, for instance, the curve in the neck. Maybe it was going in the wrong direction, or maybe there are other issues with it. We want to test it. We want to see it visually so that we can prove we're making progress. We also want to measure symptoms, and so just subjectively on a regular basis we're going to be checking in, making sure we know where you're at. So when I saw this podcast today and I heard them just slamming anyone who gets repeated adjustments or a chiropractor who practices that way, I thought, you know what, there are a lot of people out here who just do not understand the situation at all, and they're speaking without real knowledge. That's a problem, right? I'm not an expert in drugs or medication, so I'm not going to try and speak with knowledge about them. Same would hold true for me talking about surgery. I wouldn't presume to try and talk to you about a labral repair in your hip joint or your shoulder joint. I know so little about that. So when people make these comments about chiropractic who have not studied chiropractic, who aren't even a physician who has really researched chiropractic to understand what's going on, they're not talking with any understanding or knowledge. But now you know how we practice in our office, and feel free to compare that to how other practices operate and choose what's right for you. We feel very comfortable and confident in our technique and our approach. And when we look at people months or years down the road after they've begun care or even completed care perhaps, they are so much better off. And this is reflected also in our reviews online. So have a look and have a great day, and choose wisely when picking your chiropractor. Thanks for listening.